Health Topics Tuesday, sponsored by Star Valley Health, and today we are with the Chief Medical Officer at Star Valley Health, Dr. Kirk, with our Health Topics Tuesday. Dr. Kirk talking coronavirus today and what Star Valley Health is doing to be out in front of it. Understand you're in daily conversations with the Lincoln County Public Health and the state departments. Tell us what the conversations have been and what the health and what Star Valley Health is doing.
Thank you so much for allowing me to have the opportunity to talk to the community about this. Obviously, there's a lot in the news about the coronavirus, and people are getting lots of different information. So, we're doing our best to be as prepared as possible. We started having weekly meetings with a large variety of individuals from around our campus at our hospital, and it's also included public health. This is a community issue. This is not just a hospital issue. And we're just trying to be prepared for the likely event that this coronavirus comes into our community.
Now, we spoke with the State Department of Public Health recently, and they were, talking about how there was no confirmed cases in Wyoming and not even any signs that coronavirus was in Wyoming. So what specifically is being done on a local level in the event that there is coronavirus coming?
So coronavirus, the important part of it is we consider this an airborne pathogen, meaning that simply breathing in air that somebody has contaminated by a cough can lead to infection in somebody else. And so there are special precautions that we have to take as healthcare providers in order to see patients who might have this particular illness. And we also have to prepare to have them in the right location in our hospital. We have something called reverse isolation rooms, which exhaust the air out of the hospital or through a HEPA filter, which is a very refined filter to deal with this sort of pathogen or virus. And so we are trying to make sure that we understand the correct flow in which we want to have patients come to our healthcare facility. Right now, none of our facilities, none of our clinics, including the one here at the hospital, have any of these special rooms. And so we don't want to contaminate those particular facilities if we think somebody has the coronavirus, which is quite possible if we don't take these precautions.
Dr. Kirk, Chief Medical Officer with Star Valley Health. Dr. Kirk, how serious is this on a local level? A lot of people, we hear this all the time. It's being blown out of proportion. It's not a big deal. We've even heard that it's not as deadly as the flu is. How big of a deal is coronavirus?
So, good question. Influenza, which causes the flu, every year it kills anywhere from 12,000 to 70,000 people in the United States. And the rate of death related to having a case of influenza is about 0.1%. And right now, according to everything that I've read and trying to keep track of, the death rate for this coronavirus is somewhere between 1% to 3% is what they're figuring out at this point in time. Those numbers are really dependent upon understanding how many cases there are, how many people actually had infection, and how you're kind of trying to put those numbers together. So there are less people who have gotten ill with this coronavirus, but their rate of death is a bit higher, about 10 times.
Anything else about coronavirus and what Star Valley Health is doing to be proactive and ready?
Yeah, we're simply trying to be ready so that in the event that this occurs, we can deal with it in a professional manner. And if nothing happens, then we're just doing a better job of trying to deal with people that are sick. And there's a recent quote that I'd like to share with our community if possible, that I think really gets to the heart of the situation. And it's saying, being educated and understanding it and being ready to respond and support government response is very useful. Panicking and putting on your surgical masks every time you go into a public area is not nearly as useful. So understanding good hygiene, hand hygiene, is the most important thing. And surgical masks are actually most useful for those that are sick to keep them from spreading the disease as compared to wearing one to prevent yourself. Those masks simply will not prevent you from getting that if you are coughed on. So.
Dr. Kirk, what should someone do if they feel like they are having symptoms of the coronavirus?
So the best thing and what we're recommending is that they call ahead. Call their regular doctor, their clinic, call the emergency room, and they can direct you in the right location. What we're trying to do, since we have the reverse isolation room in the emergency room, is direct anybody who we have a significant suspicion of having the coronavirus. We want them to actually come to the emergency room. When they come to the emergency room, we'd prefer that they actually call us ahead of time. Phone number there is 885-5821. Let us know that what their symptoms are, their concerns, and we can make a decision at that point in time to come out to their car and or bring them in with them masked. Again, like I discussed, it's more important for those that are sick to be masked. So that's the goal, is to kind of direct them towards our emergency room and not come into our clinics per se. But, there are other viruses going around right now, and there are plenty of people having respiratory illness, and it could be influenza or it could be any other myriad of viruses that cause respiratory infections. And so talking to us ahead of time and having us help them understand whether it's appropriate to come to the clinic or the ER would be best.
Again, Dr. Kirk, Chief Medical Officer with Health Topics Tuesday on SVI.